A new law is in effect, and it is changing how pharmacies in Alabama get paid, and it could affect how much you pay for prescriptions. Fox 20's Philip Green joins us live now after speaking with a pharmacist about what this new law could mean for patients across the state. Philip?
And Jim, today I spoke with one pharmacist, and he says the new law is a critical step to keep local pharmacies open and to make sure patients can keep filling their prescriptions. For years, pharmacists have been reimbursed less than what it costs to fill some prescriptions, leading to losses for stores and less stability for patients.
It was very common for a patient to bring in a prescription. We would process the prescription, and the patient's PBM or insurance would pay the pharmacy or process the claim for less than the cost of the actual drug. It not only didn't pay for the drug, but paid nothing toward the cost of dispensing. It would be a $600 medication, and it would be very common for the PBM to pay $550 and not cover the cost.
The new law requires PBMs to pay pharmacies based on the average cost of the drug, plus a dispensing fee. Giles says that could finally make their business sustainable.
The PBM is required by law to pay the average cost of the medication plus the cost of dispensing. So if a patient comes in now, that same Eliquis prescription, the $600 prescription, the PBM must pay the cost of that drug plus the cost of dispensing it.
Since 2018, about 13% of Alabama pharmacies have closed. Giles says without laws like this, more communities could lose access to local care.
I do not know for sure that this will fix the problem. It's not a fix-all by any means, but it is definitely a step in the right direction to adequately pay a pharmacy for the services they provide and therefore be allowed to take care of those patients and maintain the access in both urban areas and also rural areas as well.
Now, Giles also says this law is about access and that more than anything, pharmacists want to keep taking care of their local patients. Live in Montgomery, Philip Green, Fox 20 News.